Hello friends, I am Dr. Kinshu Chatterjee. I am a head and neck cancer surgeon. Today I will be talking about briefly on parotid tumors and parotid cancer. Firstly, I would like to say that parotid gland is one of the largest and major salivary glands located in front of and below the ears on both sides of our body. And it produces approximately about 75 to 80% of the total saliva that is produced inside your mouth. Now sometimes in the parotid glands, people may develop a swelling in the form of a tumor or a nodule and which frightens them out. Now it is to be remembered that not all swellings or all nodules in parotid gland are cancers. Majority, approximately 70 to 80% of them are benign tumors, and the most common benign tumor is a pleomorphic salivary adenoma. 20% can have cancers in the parotid gland as well. And it is often noted that if patient have a swelling in the parotid and it's not taken care of, it's neglected, then even a benign swelling over the ages, over the years, can turn into a malignant swelling. Now, whenever a patient with a swelling in the parotid gland comes to us in the OPD, first we do a physical examination in the form of a local head and neck examination. We determine the size of the swelling, its fixity to the underlying structures. We see the skin over the swelling, whether the skin is involved or not. And we also see the facial nerve functions by asking the patient to smile, to blow, to close his eyes, and thereby we assess whether the integrity of the facial nerve is intact or not. Now, parotid gland has two major parts: the superficial part, which comprises 80% of the gland, and a deep part, which comprises 20% of the gland. Now, a tumor which arises from the deep part, or a tumor which is in the superficial part but big enough to grow into the deep part, can also present with a swelling inside the mouth in the tonsillar area. So, inspecting the tonsil is also important in these patients. As far as workup in case of a parotid swelling is concerned, we usually order a contrast enhanced MRI scan. It is to be remembered that CT scan in a parotid evaluation comes quite late in the sequence. Sometimes in advanced tumors, in advanced cancers, we often order a complementary CT scan along with the parotid MRI to understand whether the tumor has involved the muscle over this bone in the ramus of the mandible. The muscle over there is called masseter muscle, etc. And along with this, we order an ultrasound guided FNSE to know whether the tumor is a benign one or a malignant one, because that will help us determine the extent of the surgery, which is the ultimate treatment in any form of parotid tumors. Now, surgery in a parotid tumor can be either a superficial parotidectomy, whereby we remove the superficial part of the gland and leave behind the deep part intact, or in certain scenarios, we need to do a total conservative parotidectomy. Now, by total conservative parotidectomy, we mean we try to conserve all the 5 branches of the facial nerve so as not to give the patient a facial paresis. Now, patients usually have a common misconception that undergoing a parotid surgery will eventually lead to a facial paresis or a facial palsy, which is not completely true. In today's world, we do have a very advanced technology which is called an intraoperative nerve monitoring, by virtue of which we can identify, by giving a certain stimulus, each and every branch of the facial nerve, and thereby can prevent the facial nerve from getting injured or getting torn during surgery, during removal of the tumor. Now, in certain scenarios, particularly in case of cancers, or even in case of benign tumors which are very big and which have encased or which have firmly adhered to the branch or branches of the facial nerve, there might be a chance of injury to the branch of the facial nerve. Or in case of cancers which has encased the branch, for completeness of surgery, for completeness oncologically, 1 or 2 branches may need to be sacrificed by the surgeon. So this has to be clearly borne in mind, that unless and until required, a patient who has a normal facial nerve function, the surgeon always tries to preserve all the branches of the facial nerve. Usually after surgery, the patients need to stay in the hospital for 3 to 4 days, or at a maximum of 5 days, after which he is usually getting discharged. Now, depending on the final histopathology report, if the tumor comes out to be malignant, or if we know that the tumor is malignant, we look into certain other factors in the histopathology report, any adverse features present or not, and thereby we decide which patient will require a radiation therapy or not. Now, it is to be remembered that in majority of the parotid cancers, chemotherapy usually doesn't have a role. In certain instances, they do require chemotherapy, but in not all cases. So whatever the treatment is, only surgery or surgery followed by adjuvant radiation therapy, the patient is usually seen every 3 months for the first 2 years in the follow-up period. Thereafter, every 6 months for the next 3 years, and thereafter yearly once. Now, in each follow-up, the patient is seen clinically, palpated in the parotid area in the operated site to find if there is any signs or symptoms of a recurrence. And usually once a year, the patient requires a MRI scan. So if any of you or your near and dear ones, friends, relatives have a swelling in the parotid gland, do not neglect, do not ask your relatives or friends to neglect a parotid swelling. They should immediately come to a head and neck surgeon, get themselves evaluated, investigated, and get the proper treatment. Stay happy, be vigilant. Thank you.